is now my pleasure to announce that the 2022 Sasakawa Health Prize has been awarded to Dr. Paisan Ruamviboonsuk of Thailand. I invite Mr. Yohei Sasakawa, Chairman of the Nippon Foundation and WHO Goodwill Ambassador for Leprosy, to address the Assembly on behalf of the Sasakawa Health Foundation. Sir, you have the floor.
Dr. Paisan Ruamviboonsuk, I would like to extend to you my heartfelt congratulations as the recipient of the 38th Sasakawa Health Prize. I am also very pleased that we are able to attend this award ceremony together face-to-face for the first time in 3 years, made possible by the effort of WHO Director General Dr. Tedros Adhanom and WHO staff. This health prize was established by my late father, Ryoichi Sasakawa, in 1984. It was based on his belief that promotion of primary health care is essential for improving the health of all humanity. Since then, this award has recognized individuals and organizations engaging in innovative efforts to improve people's health, and at the same time, establishing greater equity in health through the promotion of primary health care. Distinguished participants, this year's recipient, Dr. Ruamviboonsuk, as an eye specialist, has worked tirelessly to combat blindness among diabetics, a serious problem, particularly in rural areas. In the world today, 100 million people have no access to cataract surgery. 700 million people have no access to eyeglasses. 1 billion people could have avoided the loss of eyesight. The grading method he established for screening and detecting blindness, as well as his training of healthcare professionals, saved many from blindness in Thailand, with a profound impact on health enhancement in the country. For example, the Thai Ministry of Public Health now offers free screening tests for patients with risk of becoming blind from diabetes. I'd like to express my respect to Dr. Ruamviboonsuk for going as far as improving Thailand's health system through the practice of primary health care. It is indeed an honor for me to present this award. I myself, as WHO Goodwill Ambassador for Leprosy Elimination, I have visited 122 countries over the years in the effort of eliminating leprosy. Even during the COVID-19 pandemic, ministers of health and others around the world have joined me in these efforts in the spirit of don't forget leprosy. As one also working towards our shared goal of health for all, I would again like to congratulate Dr. Ruamviboonsuk and wish him every success for the future. Thank you very much.
Merci, professeur.
Thank you, Professor. It is my privilege to present this prize to Dr. Paisan Ruamviboonsuk.
J'invite maintenant le docteur Ruamviboonsuk.
I invite Dr. Ruamviboonsuk now to take the floor.
The President of the 75th World Health Assembly, the Director General of the World Health Organization, and distinguished members and guests. About 20 years ago, diabetic eye disease was the second leading cause of blindness in Thailand, accounted for 30% of all blindness. We had 600 ophthalmologists to examine 4 million people with diabetes back then. Well, at the time, the team at Ruamviboonsuk Hospital and Department of Medical Services created thousands of non-physician healthcare personnel, such as nurses at primary care units throughout the country, to detect patients with sight-threatening diabetic eye disease and refer them to have treatment by ophthalmologists. This small project turned into a nationwide screening program, fully supported by Ministry of Public Health. Well, according to the latest survey of blindness in Thailand, diabetic eye disease is no longer the leading cause of blindness, accounted for only 5%. However, the number of patients with diabetes is rising. We had almost 7 million people with diabetes in Thailand at the moment. The project hasn't yet finished. We are exploring the use of artificial intelligence in the program. We hope that this will further improve patient access and decrease burden to overtrained personnel. I thank the World Health Organization for recognizing this lifelong project of preventing diabetic blindness in Thailand. This Sasakawa Health Prize belongs to everyone who involved in this project since the beginning until now. Well, as Mr. Sasakawa said, there are 1.1 billion people worldwide who live in darkness due to avoidable blindness. This is only because they cannot get access to eye health services. This is too bad. So I hope that this project from Thailand will inspire actions to integrate eye health services into health system worldwide to achieve the goal of the United Nations to give visions to everyone by the year 2030. Once again, I thank the organization for giving this award to Thailand. We are proud of it, and thank you all for your kind attention. Thank you.